Hi, and welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy. And today we're going to be talking about a topic that I don't think has really been discussed. We're going to talk about libido in Lyme disease. And so this is going to go way beyond just feelings of fatigue and lethargy and pain and just not being in the mood and really dive into the physiological connection between Lyme disease, sex hormones, and low libido. And here with us to talk about this, not only is a doctor who specializes in treating Lyme and complex chronic illnesses, but she's also the libido doctor. So welcome, Dr. Diane Muller. Tell our audience a little bit more about yourself and how you came to specialize in these two really important topics.
Yeah, thank you so much. So it's great to be here, everybody. And one of the things that I think so many of us, one of the reasons why so many of us end up in these professions largely is due to our own interests, our own pathologies, our own histories, those sorts of things. So I've been a Lyme doc for many years, about 15 of them. And that started because of my own issues with Lyme disease. I had chronic pain, I had fibromyalgia, headaches, migraines, all the kind of things. And the stories with that I like to tell, like one, my pain was so bad that it actually felt some days like I was getting my leg sawed off. I would sometimes get stuck in a sitting position. The worst one was actually getting stuck on a toilet where I couldn't actually move because I was stuck in such bad pain and would have to have somebody physically carry me. And then other things that were happening with Lyme included things like memory loss, leaving my home, forgetting where I lived, numbness and tingling so bad in my hands that I couldn't feel things like as I was carrying them, for example. So it was very obvious to me that I needed to study this. And like so many people, I was misdiagnosed for so many years. And eventually, after my own studying in naturopathic medicine, I ended up learning about Lyme disease, tested myself, and that really became my journey with Lyme. And so many people, in this topic we're talking about today, Dr. Mariah, so many people, when I tell them I do Lyme and libido, it's so easy to be like, well, these things seem so different. But actually, and one of the things we're going to, explore today in our talk is like how related these two types of illnesses, how related they actually can be and how causative they can be. And libido was actually something that I was interested even prior to my Lyme diagnosis. I have a horrible history of sexual assault. And after that happened when I was 19 years old, I wound up just feeling really disconnected to my female anatomy. A lot of pain, a lot of numbness, and frankly, a lot of confusion. And as I went through healing from that, from a mental, emotional, psychological standpoint, I still was noticing like no ability to enjoy pleasure, no ability to connect to my partner. And that was long before the Lyme symptoms really started coming up. So it was a huge interest of mine that kind of got diverted as I went into the Lyme, process and studied that deeply. So that's why later on, as I was, had repaired myself from Lyme and all those crazy things that go with that, I also got back into studying relationships and hormones and tantra and, and sexology and various types of things like that to really have these two very unique, but as we're going to talk about today, like pretty interrelated topics.
Thank you so much for sharing your personal story with us. And I think, you just nailed the first question. So I've heard you say that Lyme is an interrelational issue. Can you explain what you mean by that?
Yeah, it's so important, right? Because I think with Lyme, any of those of us that have gone through this, it's so isolating, right? That's why these social media Lyme chat and support groups become really popular because it's just looking for people that understand. One, especially when oftentimes we look normal and everything seems normal in the common lab test, yet we know there's something wrong. So, what I mean by interrelational is the impact that it actually impacts the friends and the family network. So I have seen divorces over this. I've seen breakups. I've seen people realize that they can't have babies or feel like they can't have babies in the middle of disease and that lead to complicated things. I've seen friend group changes and I feel like So much of the support right now that is given to Lyme survivors is really just about their physical body, which is essential, right? We obviously have to do that. But there's not a lot of talk yet about, like, what about the influence on the marriage or the relationship? What about the influence on your friend circle and your children and all these sorts of things? And that's known in other diseases, like, cancer, for example. There's a lot of emphasis with something like cancer or alcoholism on supporting the family unit with these sorts of things. But there's not as much talk with this yet on Lyme disease. And I really think it's essential because we can so often have our complete family unit fall apart due to our illness. And yet, nobody is taught as a spouse, as a partner, as a child, how to really be in relationship with somebody that is suffering from these things. And of course, in the relationship to libido, right? What happens to our marriage, to our relationship when all of a sudden we don't have the energy or the thought or any capacity to even think about intimately showing up for our partner when we feel this way. So there's so many different ways that these are all, connected and really play into impacting the entire community.
Yeah, that's such a good point. There's not many other diseases that not only affect your entire body, but also, your brain and your emotions and your capacity to be there for other people, much less even, yourself. So, yeah, that's such an important point. Strictly talking about libido, how often is low libido a symptom or associated with Lyme and other tick-borne diseases?
Yeah, it's a great question. And I've looked up stats on this and cannot find any from, say, a research perspective. But it is something that has been on my questionnaire for Lyme since 15 years ago when I started working with Lyme disease. And I can tell you almost 100% of the time, people, at least that make it their way to my office, have low libido. So I think it is absolutely a symptom from what I've seen clinically and from the data I've personally collected, almost in every case.
Yeah, we have the same question on our checklist as well, and it's almost always checked off.
Yes, exactly. Exactly. And the easiest way, and we'll get into more mechanisms as I know today, but the easiest way I know a lot of people say, like, how do you expect me to think about sex? How do you think about me to expect to think about intimacy when, like, I can't even get to work, I can't even make my bed, I can't even take my child to daycare or gymnastics or whatever it is. How am I going to even begin to think about sex? So obviously that's like one of the more obvious ways that people are oriented to this.
Right. And to that point, so how does somebody know, like besides the obvious, that they have low libido?
Yeah, great question. So, medically speaking, it's kind of a funny way we diagnose this. And it's kind of a funny way because it's still very subjective, meaning it's still a personal, say, way we are speaking of it. So, the medical definition of low libido medically is actually defined as hypoactive sexual desire disorder. So, that crazy mouthful.
Hmm.
And like why we do that sometimes, I don't know, but we do in medicine. And so essentially how we define that is basically reporting a low desire, a low sex drive for 6 months or more. So if you report that to your doctor, then they say, "Oh, you have hypoactive sexual desire disorder, aka low libido." But like I said, it's subjective. So the first part of that is like not really well defined is that, well, what is that normal? Like when are we reporting to our doctor that our sex drive's low? Is it like when we have a desire like once a week, once a month? So it's still not very clear. So the way I like to define it is there really is two different ways. One, do you feel like you could be improved with better relationships, less stress, better sleep, less neuroinflammation, better happiness, right? All of these types of things, because that's what we actually see the hormones that are related to sex. When we release them, we see all of those things change and improve. So if we could say, hey, we could feel better, we would like to improve any of those things, it's probably worth working on the libido. So that's one way to look at it. From an interrelational standpoint, when we look at studies around libido, what we wind up finding is that most couples that report the highest on happiness index scores have an intimate type of acts, and I'm using that because I don't want to use sex because we're talking about way more than just penetration, right? We're talking like way more around anything that we can put into a sexual intimacy category. And it's once a week. So I would say, based upon that, and saying, okay, well, once a week related to happiest couples, then we might say if we're not having a drive to actually interrelate that way in once a week or more, then we could probably say, hey, our libido is low.
Okay. So, how give us an overview of what you think the major, like, physiological contributors are, and then let's kind of break them down one by one. So, obviously, hormones, right, are gonna play a role. We know that Lyme significantly messes up both female and male hormones. Can you talk a little bit more? Just start there.
Yeah, so hormone wise, we absolutely want to make sure when we're saying hormones, we're talking about sex hormones, adrenal hormones, and thyroid hormones, because all of those really actually can impact the drive. And from the standpoint, so you want me to actually list them out? I just want to be clear on your question. You want me to actually
Well,
list them
however
out
you wanna
first?
present it is fine. I
Okay.
just think
Okay.
sometimes it's helpful for the listeners to kind of get, like, an overview before we dive
Yeah.
deep into specifics.
Yeah, let me list them out first. So if we're talking hormones, and let's say, okay, from a libido standpoint, we're talking sex hormones, so estrogen, progesterone, testosterone, adrenal hormones, so cortisol, DHEA, and our thyroid hormones. Those are the real common ones that are going to impact libido. We also see our cardiovascular system, and it's really known for men, a lot of like erectile dysfunction, for example. We think a lot about cardiovascular health, but women also need proper cardiovascular flow for proper arousal. So, cardiovascular health is another one. Our nervous system is a huge one, and neuroinflammation is a big reason for a low sex drive. So we see neurological. Then obviously, of course, we have psychological. So we have that mental standpoint as well. And then beyond that, all of our diet, lifestyle, those sorts of things. And I am missing one in my brain right now. Let's start there. It'll come back to me. I'm missing that one right now. So let's keep
Okay.
going. So do you want me to go through them one by one now?
Yeah, so why don't you start with, like, with the hormones?
Okay, perfect. So hormonally, oh, and you know what? Why I'm missing one in my brain now I realize it, because I usually put stress and adrenal hormones into a different category. So I mentioned that already. So I'm not missing
Okay.
one. Okay, so hormonal wise. So what we're talking about here, let's go through them kind of together. So I've looked at a lot of research to say, hey, can I see anything that is like super specific on Borrelia lowers testosterone? I have not been able to find anything like that. However, what we can find is, and I'm going to take a step back to say, again, clinically, what I notice is oftentimes, as I imagine a lot of Lyme literate docs notice, is that when we have Lyme, we do see a lot of hormones fall. Cortisol can be high or low, thyroid can oftentimes be low, sometimes high, and we see sex hormones oftentimes in the gutter or in very weird balance of each other. So, do I see a study on Borrelia actually say lowering testosterone? No, I have not found that specifically. However, what we see, for example, we see other things. We see that cortisol, for example, can lower testosterone. So, if somebody is in that early stress stage where their cortisol is high, and we see that Borrelia has actually driven that cortisol up due to that early onset stress, that can lower testosterone, for example, can also lower estrogen. And estrogen and testosterone are two of our key, most important hormones, of course, when it comes to libido. So that's a really important thing there. From a thyroid perspective, there are studies that are showing, especially when it comes to autoimmune disease, there are studies that are showing that all those inflammatory markers that often raise with Lyme disease trigger an autoimmune response. That's why some people say that late stage Lyme is actually autoimmune Lyme, is because we have this almost autoimmune like process happening on our cells. One of the cells that can get impacted by Lyme, of course, is our thyroid. And so we see research that says, okay, well, if the thyroid is impacted negatively, and low thyroid hormone will actually lead to a lower testosterone and estrogen production. So we can see very similar things with cortisol as well as thyroid, where we can see that process of those sex hormones actually lowering because of the Lyme. Another interesting thing from that inflammatory molecule standpoint is MMP9. This is an enzyme. It's associated, we talk a lot about it with mold, but it's an inflammatory enzyme. It's called matrix metalloproteinase. And this particular enzyme will actually elevate also with Lyme. There are some studies on this. It's been associated with one of the reasons for things like Lyme arthritis. Well, what's interesting from a hormone issue as well is that MMP9 is also secreted in women around the time we menstruate. It's one of the things that is a kind of a signal to tell our tissue to break down and slough off, right? Because it's a proteinase, it's breaking down protein, it's breaking down, unfortunately, the tissue in our joints, but also at in healthy levels at menstruation, the tissue that is actually causing our uterine lining to slough. So, if you're kind of putting all this together, what can be happening is that when we have Lyme and when we have an increase in some of these inflammatory molecules like MMP9, and then we go through our menstrual cycle, which is going to increase that inflammatory molecule even more, that's one of the relationships with all of a sudden why we can see pain, we can see menstrual disorders, or we can see these situations, which I know a lot of us in the Lyme community see, which is women go through their cycle, all of their symptoms worsen. So there's that inner relationship to the cycle and to that proper hormonal cycle and that proper menstruation cycle, which of course can be linked also back into libido through these inflammatory molecules.
That is so interesting. So I would say with almost all of my female patients, they all tend to get worse in the couple days prior to their flow or their menses. And I never knew that that was the connection. But I talk about MMP9, which is AKA collagenases, right? So this is that inflammatory enzyme that breaks down the collagen and actually feeds the spirochete, feeds Borrelia, breaks down our joints, causes arthritis, etc. But I had no idea that this was the actual link as to why there's such an exacerbation of symptoms. So that's great to make that
Yeah.
connection.
Yeah, I love understanding the whys, right? It's like it's so fun because most of us see this stuff clinically, and so we know this because we watch these patterns over and over and over again. But it's really fun to understand, like, oh, that's why that's happening. So that's one of those really super interesting links there. Should we go on to the stress component?
Yes, please.
Okay, so I did mention this a little bit already by saying high cortisol can also lower estrogen, testosterone levels. So we see that over and over again. High cortisol can also create that dysfunction in our brain and our hippocampus and our memory, and so that obviously is a stress and doesn't tend to make us super, say, horny, super interested in sex and sexuality from that standpoint. So one of the other things that's really important to mention, though, with this is DHEA. So DHEA is oftentimes lowered. We see this frequently lowered with Lyme disease. And so when people have a lower DHEA is that precursor to testosterone. And testosterone, of all the hormones, both for women and men, is the hormone that is super linked to healthy libido more than any other hormone, right? We want that testosterone as a high driver. So when we see Lyme lowering DHEA, which it commonly does, then we see a lowering then of that testosterone downstream, and that's actually going to drive that libido. And what's also interesting, and I know we're going to, come to this later, but just because it's DHEA, is a lower amount of DHEA I've seen in certain situations to heal common cases of vulvodynia, that pain in the vulva. And I know we're going to talk about that a little bit more later, but that's very interesting to me in this because we see Lyme sometimes as a precursor to that vulvar pain. We see Lyme also lowering DHEA, And then I've seen DHEA applied topically to the vulva really help to reverse, in certain cases, vulvodynia. So we can like use DHEA in a way of like getting our libido back, supporting our energy, kind of healing that, but then also in working with healing things like vulvodynia that can in some cases be caused by Lyme disease.
Right. So since we brought it up, do you mind just talking about it right now?
Sure. Yeah.
Okay.
Happy
So
to.
let's just talk about that a little bit. So one of our upcoming questions was going to be the link between Lyme disease causing vulvodynia or vaginal pain, pain of the vulva. Can you elaborate a little bit more on that? Because I have so many patients that have this as an issue, and it is just like mind blowing to them when I say no, like this can be one of the symptoms of Lyme disease as well. And, when you're answering, if you could talk a little bit about, do you think like, is this almost like a form of neuropathy? Is it mast cell derived? Like what is the mechanism that's going on here?
Yeah, there's so many different actual mechanisms that really could be happening here. So we see that vulvodynia is sometimes even just like an ulceration issue. So there could be some sort of lesion or ulceration. We see that it can be a neurological, it can be a pain and a nerve root issue. So this typically happens if the nerve roots in like the lower thoracic, the upper lumbar, or the sacral. So basically low spine and tailbone, for our listeners, like those areas, the nerves in our low back, in our tailbone areas, if those are inflamed, that can be contributing to the vulvodynia. And one of the things, like from a Lyme standpoint, is we know that Lyme can cause neuroinflammation. That is super interesting, right? And there's definitely cases of that and research on that. So that's very, very clear, and it couldn't cause neurological pain syndrome, right? And what's interesting from a standpoint of vicious cycles, like one of the things I talk about in interviews like this a lot is the vicious cycle that we get into in medicine. And a vicious cycle to me is like a chicken and an egg. It's almost a what came first, how do we get out of it? And it's interesting, the vicious cycle I see is that we have pain in our vulva, and that's caused by neurological inflammation. It's caused by ulcerations. It's caused sometimes even structurally. Borrelia, that creates the neurological inflammation, can cause this. Another thing that can cause it is the detrusor, like the bladder muscle. So that bladder muscle that actually controls that stretch of like, oh, we have filled up with enough urine in our bladder, we need to stretch appropriately and then contract appropriately when it's time to release urine. So we see that muscle, which Lyme has been shown to impact. Well, that muscle has been linked to problems with vulvodynia as well. So we see all these different reasons for it, and the bladder detrusor muscle, as well as neurological pain syndrome from Lyme, both of those things can actually be impacted and caused by Borrelia here. So the vicious cycle can be one of the things that can really help and actually calm nerve pain is enough oxytocin. Oxytocin is that intimacy molecule. It's that love molecule. It's that hormone that we release when we cuddle, when we touch, when we orgasm. And so that will actually help from a standpoint of pain reduction. It'll help with a standpoint of neurological inflammation reduction. And there's studies on that. And so oftentimes like that can be a way we actually get out of some of that pain, and we can actually repair that way. But of course, when we're not interested in intimacy and sometimes touch, often with things like fibro and all these other symptoms that go with things where it's like a little bit of touch actually feels bad, not good. Sometimes then it's hard to access the hormone that we need to actually get out of this.
I would like for you to tell our listeners how they can get a hold of you, and if you have any exciting news or events coming up. Dr. Diane, please tell everyone how and where they can find you.
So super easy stuff for you guys. So if you go to libidoquiz.com, super easy to remember, just libidoquiz.com, you'll actually find a free quiz that will actually, the first part is a research-based questionnaire quiz, which it'll guide you through, is your libido actually low or not? If you get yes to that, then it's going to basically give you the root causes. It's going to ask you more questions, and it's going to tell you the top root causes of all the things we're talking about today, of which one is most likely your number one root cause based upon your answer. So it's totally free. So you can go to libidoquiz.com to really get that and get information on likely root causes that would be perhaps a good place to start with in your journey. And then you can find my two practices also super easy at mylibidodoc.com and mylymedoc.com. So super easy.
Wonderful. Thank you. Okay. So diving back in. So we talked about adrenal and stress. We talked about sex hormones themselves. I think you briefly touched on cardiovascular health. Why don't you continue with that?
Yeah, I think one of the important things, there's two important things to make a note of here. One is that cardiovascular disease we know is the leading cause of death worldwide. And oftentimes a low libido is a early warning sign of a cardiovascular problem. And men tend to go to their doctor frequently when this is a problem because it usually leads to erectile dysfunction. And that oftentimes is, the most men I know that have gone through that, that's like motivating, right, to see a doc. Women, however, it might show up as lower arousal or a little bit of pain or low lubrication. And sometimes those aren't as motivating reasons to go to a doc right away. And it could actually be an early warning sign of a cardiovascular problem. So I like people to know that because those symptoms of like, oh, something's changing could actually be a bigger something than you may realize. So that's important. The link with Lyme, since that's our topic today, really comes down to Lyme carditis, right? So we know that Lyme can affect the heart. We also know that Lyme, through its inflammatory, systems, can actually infect the vasculature. Like the vasculature, we know more and more that a lot of what's creating things like coronary artery disease is this oxidative, this like toxic type of stress on the vessels. And Lyme, of course, through its crazy biotoxins that get released, as well as through its inflammatory processes, can really create that vascular stress. And so that's that link then of, so we have that vascular stress. We know that vascular stress can actually be linked to low libido. That's very, very, very clear. So that's really how those two things fit together from a causation standpoint.
Okay. And then what would be the next?
So beyond that, so we've talked about sex hormones, we talked about cortisol and thyroid a little bit. The next thing really to talk about is the neurological system. So we have to have, with every process in our body, we have to have that proper neurological flow, right? We have that stimulation to the tissue. So from a neurological system standpoint, if our nerves are inflamed, we know Lyme disease, we know co-infections, we know mold, we know all these things cause this neurological inflammation. So we have our nerves that are not firing correctly. They are not actually signaling tissue correctly, and that can actually be contributing to that low arousal. It can be contributing to a low lubrication, to a low responsiveness of the tissue. And, another thing that's really interesting with that is the female versus male cycle of arousal, right? Because most of us, even in medical school, we're just taught at this like male linear cycle of arousal, which is really, hey, we get excited. There's this, we feel aroused, we get excited, we engage intimately, we climax, and then we go through a refractory period. And that's what most of us were taught as far as, the arousal cycle. Well, from a neurological standpoint, if we're not stimulating, if the nerves are not sending that information to the arousal tissue to get aroused, that could make a difference there for men. But for women, what is interesting, and I really appreciate a model of female arousal done by Rosemary Basson, and she redefined female arousal. So it's much more of a circular situation of arousal. So by the circular situation, what it is many women don't get aroused until you actually start engaging intimately. And because we're taught that arousal is just you get excited, you get kind of turned on, you feel a certain something, and then you move from there into intimacy. Well, for females, because our anatomy, because our blood flow to our brain and estrogen and progesterone dominant scenario, because that blood flow to our brain is different, oftentimes we don't start getting aroused until we actually engage intimately. This is why women commonly will report to me like, oh, wow, okay, I tried having sex last night and I was not in the mood and did not feel like it. And then like 10 minutes into it, I was like, actually, I'm really glad I'm doing this. And then like laying afterwards and, saying to a partner, like, wow, I'm really glad we did this. Why don't we do this more often? And it's because nobody has taught women that arousal does not always come first. Sometimes arousal actually comes later. But if we're in a situation where we are so neurologically inflamed and our nerves are not sending that response to our tissues, just like with men, that arousal may not happen in that way that is making that pleasure sensation really possible. So we want to restore that neurological dysfunction so that we can actually get those signals going to our erotic tissue more appropriately.
And so, how do you recommend doing that? Like, what are your go to therapies for decreasing neuroinflammation?
Yeah, and there's a few different things. I mean, one thing is if we're talking about neuroinflammation causing pain. So if we're back to the vulvodynia scenario, if we're talking about that, I like people to know that there is a study that a colleague of mine did internally. And this is a sex toy, a sexual massager company called Mystery Vibe that I really like because they're so research based. So they did a study that showed that 3 times a week of a sexual massager toy, so 3 times a week used for 12 weeks, had a 5 times reduction in pelvic pain. So to me, what's happening there is almost this neurological repair where it's like we're starting to get, it's almost like fibromyalgia, right? Where it's like those pain signals are incorrect, and that threshold of like with fibro where we hit our hand on the desk and all of a sudden it's like it wouldn't even register to somebody without fibro as pain, but with fibro that pain threshold so dysfunctional that the nerve sees that and senses that and feels that as pain, and the brain then registers that it as pain. And so the same thing I believe is probably happening when we see studies like this 3 time use for 12 weeks, 5x reduction of pain in the vulva is when we are actually putting a little bit of pressure and stimulation and vibration on the tissues is perhaps due to a almost like this neurological reset of actually changing that pain threshold. So that can work. Sometimes internal massage can work. I mentioned DHEA on the vulva earlier. DHEA is just absolutely amazing, as far as healing the tissues, as far as reducing pain, vaginal lubrication. I really like a product called Jolva. People can get that on my store. It's by Dr. Anna Kabeka. And I like her product because it's DHEA, but she also puts stem cells into her product, and you use it topically on the tissues of the vulva, the clitoris, and even all the way down to the anus and the anal sphincter. And that actually causes the tissue to rejuvenate, and it prevents things like atrophy, where the tissue shrinks and just is not as functional, which happens with Lyme, but it also happens with aging, right? So DHEA is a really good thing. Cuddling is amazing. And if you're like at a point where it's like you can't be touched due to your Lyme symptoms, I get it. And that obviously we have to lower those symptoms first, but just engaging intimately, even if you're not ready for anything that is sex or sexual in any way, even just saying, okay, partner, how can we actually have a cuddle date and literally cuddle? 20-second hug, right? The 20-second hug has been studied and researched for that's how long it takes for oxytocin to be released. Again, that's that hormone that is improving sleep, that is lowering inflammation, that is doing all these things. Well, we see is 20 seconds is where you really get that oxytocin boost, and you get more and more and more oxytocin the more frequent you do those 20-second hugs. And so if you've never tried a 20-second hug, try it because it's actually a lot longer than you think. Like when I first studied this research, I was kind of obsessed in my social circles around like, just like counting when I hug people. And oftentimes 5 seconds is or less is all we tend to hug people. So it's simple, but it really releases that oxytocin and can contribute to a lot of that stress reduction as well. So, and then certainly there's other things, right? For cardiovascular, we want to consider things like citrulline. Citrulline is an amazing amino acid that will actually help to dilate our blood vessels and to bring more blood to that area. And then, of course, it goes without saying on your summit where people are hearing so much of this, but just to always throw this in there, we, of course, always need to get back to the root, right? So we want to make sure we're absolutely taking care of Borrelia and toxins and anything else that's going on as well.
Before I forget to bring this up, can you talk a little bit about how hormone imbalance or having low levels of estrogen and or testosterone negatively impact the immune system and actually could help this infection to thrive and survive inside of the body?
I mean, from a standpoint of actually, say, going in and lowering T cell function or those sorts of things, I don't know that I have like a study to say, okay, our white blood cells are directly impacted by this. That would be a good thing for me to look up to see if that study exists. So I can't talk about it from that standpoint.
Mhm.
But what we can, what I can say is just more of like the overarching obvious thing of if we don't have those healthy hormone levels, like for example, like we see that estrogen and progesterone, but especially estrogen, it really impacts things like memory and brain health and brain function. So from that standpoint, it's like I would extrapolate that when we are seeing lower levels like that of impacting the brain, we could perhaps see some immuno properties that way. But I don't have like a specific study of that as far as like the immune system and estrogen and testosterone.
Okay.
Yeah.
I've seen in a few of my patients where women have had really low levels, specifically of estrogen. Even if there's like a progesterone imbalance or an estrogen dominance, when the estrogen is lower, and then the women who have chosen to go on like a bioidentical hormone replacement, it's kind of like once that happens, their ability to manage this infection is night and day. And again, obviously, these are the women that have the very deficient hormones. So, this wouldn't be like a one size fits all thing. But it's just so apparent how important having these hormones are for the overall like immune function, inflammation, etc.
Yeah, I mean, I definitely see the same. I mean, that's why even in my book, It's Not in Your Mind, I talk about like a four-part way of healing from Lyme. And one of the first things I say is phase one, I call it the rebuilding phase. And in phase one, we work on thyroid, we work on adrenals, we work on sex hormones, we work on mitochondria. And I've seen from a standpoint of herxing and all those things we talk about with Lyme disease and hypersensitivity and whatnot, that there's so much less of that. And that I see treatment goes so much better when we build up sex hormones, we build up thyroid, we build up adrenals before we actually go in and say, let's do any of our antimicrobial treatments to actually address Borrelia co-infections. So I completely see it in my practice too. That's why I organize things that way most of the time. Yeah.
Yeah. All right. So we've talked about Lyme's impact on libido.
Yes.
So let's flip it around. Can working on libido help in Lyme treatment? I know for a lot of people, it's kind of like the last thing on the totem pole, and it can be looked at as, just one more chore and thing to do. But can you talk a little bit about the benefits of enhancing libido and being intimate and having that intimacy in the ability to actually help and resolve the infection?
Yeah, this is another chicken and the egg type of scenario, right? Because, yes, absolutely. Like working on libido can absolutely help with Lyme disease. And the way that I have seen it help really is with symptom alleviation, with sleep improvement, with improving a level of like happiness and serotonin while we are going through this, improving relationships, right? So it's like, oh, there's so much that gets put on the back burner when we're in survival mode naturally, right? Of course there is, because we're trying to survive. But the subsequent thing, like we started our interview with today, is like relationships get impacted. And so the ability of even engaging to a level intimately can really support the relationship. And that can also lead back into having more supportive care from a Lyme perspective. But the bigger things I've really seen as far as working on libido is truly is sleep improvement, stress reduction, inflammation reduction. So that's obviously can translate sometimes into pain reduction, symptom reduction. So the way I like to describe libido is interesting because we talk about so many other things with Lyme, right? We talk about like, okay, we got to get good sleep. What can we be doing to get people to sleep to heal? We got to work on the diet and get the gluten out and the inflammatory foods, the high histamines, and all the things that we commonly do from a lifestyle component. We got to move the lymph. We got to get, so all these things. And libido oftentimes is not talked about in a way from a lifestyle perspective standpoint. And the reason why it's important to consider is because of that hormone oxytocin I keep coming back to. That is that it's a master regulatory hormone. Like we don't realize oftentimes in public societies, we don't actually realize because it's not talked about like how much this hormone will actually regulate the other hormones of our body, our happiness, our sleep, and all the things I mentioned. And so when we are trying to get our pain down, when we are trying to get our sleep better, when we are trying to find a level of like serotonin, happiness, and like just the tiniest little glimpse of that to help us survive this, actually working on our libido can improve all that. So then the biggest question is that's the most obvious question that people are probably thinking about this is like, okay, that's great, Dr. D, but like, how am I going to do that when I can't even think about engaging in sex when I have no drive and I just feel horrible. I'm just trying to get through the day. And that's when we can actually begin to open up like what we actually mean by libido, what we actually mean by sexuality, right? So that could mean, for example, that could mean like we have one date, one date a week, we even one date every couple weeks where we are just laying in bed in whatever position is the most comfortable and just touching and holding each other's bodies, right? There can be different ways of accessing this that doesn't have to be the classic definition of sex in order to still get all those hormones. So this is a time to actually get creative with your partner if you have a partner, creative with yourself if you don't, and really begin to say, okay, well, within the context, just like we ask with every other question with Lyme disease, within the context of movement, what type of movement can your body handle and not hurts, right? What type of, position do you need to be in for sleep? How do we maximize that? And libido is the same. The more we can become curious about it and say, okay, well, what ways can we explore touch when I'm exhausted, when my body hurts? What ways are still available to us? And sometimes we do that, we can actually find really creative ways of connecting to our partner when we actually look at this as like, this doesn't have to be traditional intercourse. There can be a lot of other ways of exploring this and still getting those hormones released, still having that connection and, in touch, still caring for our partner, showing that bidirectional love and so forth. So I think the creativity around this and really releasing the fact that libido equals sex from an intercourse standpoint is part of how we solve that.
Yeah. So how do you suggest that people talk to their partners about this? Because I think for a lot of people, it's a hard subject to bring up, especially when you have Lyme disease and you feel the way you feel. And, for most people, it's probably already become an issue. So
Yeah.
do you have any suggestions on how to go about that conversation?
Yeah, the way I describe it is the how, the when, and the where of these conversations. So the where is very basic. I go through a lot more of this in my, my course material, but just to keep this pithy for our time allotment today, the where is essentially literally that. So it's like having these kind of conversations in the bedroom, probably not a good idea, right? You want to make sure wherever you're associating a conversation that could be a little bit sticky is not that same place where you want to engage intimately because you don't want to be engaged like that way and all of a sudden have that trigger of that memory of that conversation that perhaps did not go as smoothly. So you want to make sure you're, just kind of protecting yourself that way. So where is really important. When is also important. Like when obviously is you have to consider your own needs, but I would consider when are you the most resourced throughout the day with Lyme? Like most people I work with Lyme have like, one point in the day where it's like, okay, like, yes, it feels bad all the time, but maybe at 10:30 a.m., maybe it's like a little bit less bad, right? So like, when are you going to be the most resourced? Is there going to be a time of day? And the way that I tend to tell people to frame it as far as when for their spouse or their partner is to make sure to almost give them a warning about the when, but not in like a honey, we need to talk kind of voice, right? So it's like, it's not, hey, I need to talk. The when is like the when and the how can be related as far as saying, hey, honey, like I know what's going on with me has put a lot of pressure on you and a lot of pressure on us, or however you frame it. I'm just giving you an example. I really want to explore how we can continue to stay connected in the middle of all of this. And I'm wondering if you would be available for a conversation like that at 10:30 a.m. tomorrow, for example, if that's when you think you're going to feel the best. The reason we kind of give them that information is it helps them prepare that, okay, we're going to have a conversation maybe about intimacy, but we're going to do it in a way, or they're prepared, they know it's coming, but it's not the, oh boy, honey, I have to talk, where they're going to go into that conversation with anxiety. And so that's also wrapped up in the how. And the how is also putting you guys on the same team, saying, like, we're going to explore this together. I know whether or not you understand this. I know, you might name some of the feelings they have, frustrated or whatever they're feeling, right? Because our partners have their own feelings around our disease process. And I want you to know that I'm still really interested in the middle of all of this of staying connected to you. So I want to explore some ideas and really, so that's kind of the frame. And so what we're doing there, and the how is also working to put you guys back on the same team again, because oftentimes with these crazy, horrific disease processes, we almost like get dissociated from being on the same team as our partner. They maybe not understand, they may not be supportive. So we're really working with kind of the framework and the pre-framework here to position everybody to be on the same team again. So you're actually going to that same goal of like, okay, you might not understand what's going on with me, partner, but I want to still find a way despite that to stay connected to you, which of course is easier said than done. But the goal here, right, is to hopefully get you not only through Lyme and in remission and a true survivor of this, but also to keep your relationships intact and hopefully come out of this with your relationship stronger than ever. So some of this also internally, I know this is like from my own personal experience, I've been there. It is so much will, but the will comes from, hey, I want to come out of this not just stronger. I want to come out of this and have my relationship survive as well.
Yeah, and that support system is just so important, I think, beyond obviously just with your partner, but as we started this talk, like with your family and your intimate community that you have, because a lot of times it's just so, so isolating.
It really is. It really is. And that's what because that's the other thing we see, it's like the social isolation of this really complicates things. And the number of times clients of mine are crying because relationships are falling apart, because friends have left, because they just don't have any of that anymore. And obviously, this is one of the things that makes this such a trauma, that Lyme disease is such a trauma. And that's why I think it's really important to talk about strategies around what can we do to actually keep our relationships intact during this, because even though it's hard, having that support system and really having that strong relationship is part of what I think gets people through this.
Yeah, I agree. So, what would be your last couple pieces of advice for our listeners who are struggling here?
My One of my last pieces of advice I would say is take, just like you're doing time for everything else I know you're doing, which is so much, all your supplements, any sort of machines you're using like Rife or, whatever else you're doing, every lifestyle thing, even if it is 2 minutes a day, right? To start, to wrap yourself in a big hug, to sit with a child, a partner, an animal like a pet, just something that you can just hug and cuddle up to, a living thing, preferably not just like a blanket or a pillow, but something that's living, even if it's 2 minutes a day, just like holding that person or that pet to really get that oxytocin release. I know, it's like, and then we can build from there. But even if you can start small at just 2 minutes a day, you can get so much of that oxytocin released. And The other thing I'll leave you with is like when it comes to, these types of relationships with your partner, just continue to allow yourself grace. Like these kind of things, as far as how to communicate, it's just like, sex and libido and all these things we're talking about. So many of us were not taught how to do this in our childhood in our life. So the conversation, we want to set you up right where it's like there's not that trigger of the bedroom if it doesn't go well. But it's just another example, like so many places with Lyme and chronic illness, to just radical self-compassion, working to improve what we're doing while still giving ourselves so much forgiveness, so much love, and so much compassion in the process.
Yeah. That's great advice. Thank you so much for being here with us. Why don't you once again tell our listeners how and where they can find you?
Sure. Thanks so much for having me. It's been lovely chatting today. And you can find me again by going to my libido quiz, super easy, free quiz. Going to tell you some of the root causes of why your libido might be low from a functional standpoint. So that's libidoquiz.com. And then you can also find my two practices, mylimedoc.com and mylibidodoc.com.
Okay, wonderful. Well, thank you everyone for listening. We'll see you next time at our next episode. And I hope that you've found this information helpful on your journey healing Lyme. Take care.